Nurse practitioners are advanced practice registered nurses that work under but in collaboration with a physician. Nurse practitioners have obtained additional schooling beyond the basic 2 or 4 years in college to become a registered nurse. There are many different specialties available for nurse practitioners. NPs are able to do many tasks that an RN cannot. Some of these tasks include being trained to diagnose conditions and prescribe medications and other various treatments without being under direct supervision of a physician. NPs are also greatly involved in managing the overall care of patients and educating them on prevention of disease and how to live a healthy life.
Nurse practitioners work in all aspects of patient care, such as diagnosis, treatments of acute and chronic illnesses, and consultations. Their work consists of either inpatient or outpatient, and independent work or as part of a medical team. They also educate patients about the specific treatment involved with their type of case or diagnosis. Education involves preventive care, prescribing treatments, and making positive and healthy lifestyle choices. Other duties include conducting physicals, ordering and interpreting tests based on the patient's age-specific needs, and prescribing medications. They also facilitate patient transition within and between healthcare settings and collaborate with other members of various specializations by way of referrals. Nurse practitioners serve as the primary healthcare provider for their patient.
A nurse practitioner will find that there are many areas to specialize in. School programs may offer only a few specializations, but because some MSN programs are available through hybrid or online learning, registered nurses may find their needed option by looking at a number of schools. Acute care encompasses a couple of specialties such as adult health, gerontology, and pediatrics because it covers a wide range of patient demographics. Acute care nurses offer specialized care across a continuum of acute and chronic care services for both the pediatric and the adult gerontology patient populations. Usually this involves episodic care and/or specialized care. Neonatal health refers to the specialized care of neonates and infants with complex, acute, critical, and chronic health conditions. Pediatric nurse practitioners provide care from birth to young adult, which includes childcare and prevention or management of common pediatric acute illnesses and chronic conditions.
Psychiatric mental health involves individuals, families, groups, and communities who are dealing with psychiatric disorders. Nurse practitioners in this specialization assess, diagnose, and treat patients with psychiatric disorders or the potential for such disorders. Women's health nurse practitioners deliver comprehensive health care to women throughout the lifespan, with an emphasis on reproductive and gynecologic needs. Disease prevention, taking care of illnesses, and prenatal and postpartum care are focused on as well. Some subspecialties or areas also include allergy and immunology, cardiovascular, dermatology, emergency, endocrinology, gastroenterology, hematology, neurology, occupational health, orthopedics, pulmonology, and respiratory, sports medicine, and urology.
Nurse practitioners must generally obtain at least a master's degree and must be both nationally registered nurses and certified nurse practitioners. Education requirements to enter the career can vary slightly depending on the specialty, but at least a master's degree education is necessary. These master degree education programs take 2 to 3 years to complete. They focus on providing students with the skills necessary to enter professional health settings as nurse practitioners. Graduates are eligible to seek professional certification. After completing a master's degree program, graduates are eligible to obtain professional certification as NPs. Nurse practitioner programs normally focus on the specialty area of nursing, and graduates generally choose to seek certification in the same specialty. The American Academy of Nurse Practitioners and the American Nurses Credentialing Center are 2 credentialing bodies that offer certification in nursing. These certifications must be renewed every 5 years in order to continue development within the profession.
The demand for nurse practitioners has been great. The number of NP has doubled over the past 4 years to more than 200,000 in the nation. It doesn't just stop there. The career should grow about 31% in demand in the near future, much higher than the average of all occupations, which is only 7%. Why is there such a great demand? There are many reasons: new healthcare legislation, the aging baby boom generation, shortage of doctors, and more sites of service. The roles of MPs are also increased. States are changing laws over practice authority, allowing them to perform more service. At the end, nurse practitioners are gaining more public recognition.